Our presentation's on how COVID-19 is disproportionately affecting minority communities in the United States. So for my presentation, I use data from the CDC. They have a COVID tracker on their site, and I also use Tableau's. Some background information. So COVID-19, which is otherwise known as the coronavirus, saw its first outbreak in December 2019 in Wuhan, China, during periods of close contact by way of small droplets produced when coughing, sneezing, or talking. Although less common, people can become infected by touching their face after touching surfaces that have been contaminated. Um, it's highly contagious during the first 3 days after noticing symptoms, although it can still be spread prior to symptoms appearing and via people that are asymptomatic. And the symptoms that people tend to experience are fever, cough, fatigue, shortness of breath, and the loss of sense of smell and taste. COVID-19 was declared a pandemic on March 11th, 2020 by the World Health Organization. And as of 1:30 p.m. today, the United States has a total of 4.75 million confirmed cases and 157,000 deaths, with New Jersey having 184,000 confirmed cases and 15,836 deaths. And according to the WHO, the global mortality rate is 3.4%. So how minority communities are being affected. So first, I want to look at the United States population data. So white Americans make up 76.32% of the population. American Indian / Alaska Natives make up 1.28% of the population. Asian Americans make up 5.94% of the population. Black Americans make up 13.43% of the population. Hispanic Americans make up 18.45% of the population. And Native Hawaiian and / Pacific Islanders make up 0.25% of the population. So being that white Americans are the majority in the country, I use them as the basis of comparison. So the data for white Americans show that this community is experiencing 30 deaths per 100,000. And investigators have also found that 8% of white Americans showed risk factors that can make them more susceptible to COVID-19. So American Indian and Alaskan Natives, their community experiences 40 deaths per 100,000 members of the community. And in New Mexico, American Indians only make up 5% of the population. However, they were representative of 20% of the state's COVID cases. So the Asian American community experienced 31 deaths per 100,000, which is not too far off from white Americans. However, in San Francisco, Asian Americans only make up 1/3 of the population. However, they're almost half of the COVID-19 deaths in the city. They also experience a 4 times higher case fatality rate than the overall population. Theirs is 5.2%, and the overall population is 1.3%. And in New Jersey, the case fatality rate was over 10% for Asian Americans. So for Black Americans, they experienced 74 deaths per 100,000, which is 2.5 times the rate of white Americans. And as of July 29th, 2020, 30,648 Black Americans had died due to complications from COVID-19, which is 23% of all COVID-19 deaths where race has been documented. In New York, Black Americans only make up 18% of the state's population. However, they were 33% of COVID-19 hospitalizations. And in Louisiana, Black Americans make up 1/3 of the population, but they accounted for 70% of COVID-19 deaths. So Hispanic Americans experienced 40 deaths per 100,000. And of the 38,000 patients tested for COVID-19 at Johns Hopkins Health System, there were 16% positive tests. And of those positive tests, 43% were among Hispanic American patients. So COVID-19 now accounts for 1 in 5 deaths in Hispanic Americans, as more than 25,800 Hispanics have been reported to have died due to the virus. In COVID-19 hotspots, Hispanics are making an increasing portion of deaths. In California, Hispanic Americans make up 39% of the state's population, but 46% of the total virus deaths and 57% of the deaths that have been reported in the last week of June. And the Native Hawaiian and Pacific Islanders make up 29 deaths per 100,000. In approximately 5 states, research shows that the Native Hawaiian and Pacific Islanders make up 217.7 cases per 100,000. And in Arkansas, Pacific Islands are 8% of COVID-19 cases, despite only being 0.3% of the state's population. So why are their communities being affected? So, according to the CDC, the main reason why minority communities are being affected is because the country's history with racism and discrimination. So, the United States has literally been built on racism and has not rectified its past, which has unfortunately affected how minority Americans experience life in the United States. And as a result of this, the pandemic has been able to exacerbate the racism still embedded in the country and who's dying from COVID-19 and the number of people who are dying. So, the following forms of racism and discrimination that are still prevalent in the country that have led to the previously discussed disparities include mainly systemic racism, which is also called structural or institutional racism, and is defined as systems and structures that have procedures or processes that are disadvantages to minorities. Systemic racism creates disparities and makes it more difficult for minorities to participate in society and in the economy. Relating to COVID-19, the following disparities are being noticed as explanations for the overall disparities in the rates of death. So, disparities in housing. Redlining is defined as the unethical practice that puts services, financial and otherwise, out of reach for residents of certain areas based on race or ethnicities. Redlining is felt the most by residents of minority communities. So, redlining in real estate made it impossible for minority Americans to move into the suburbs and left them living in crowded urban areas. And as a result, in most major cities, white Americans tend to be the minority. So, because minorities tend to be living in major cities together in close proximity to each other, it's made it very difficult for them to practice prevention methods such as social distancing. And furthermore, in some cultures, multi-generational families are the norm, which makes it difficult to distance with large amounts of people in the home. Growing disproportionate unemployment rates for some racial and ethnic minority groups during the COVID-19 pandemic may lead to greater risk of eviction and homelessness or sharing of housing, which also leads to increased potential exposure to COVID-19. So, disparities in access to education, which are also due to redlining. These disparities are in which white Americans living in suburbs tend to have access to higher quality education than minorities in urban areas. Lower quality education leads to lower graduation rates and causes barriers to entrance to college, which can also lead to the increased likelihood of working minimum wage jobs such as grocery clerk, fast food workers or restaurant employees, janitorial work, factory work, public transportation, etc., and all of which have been deemed essential during the pandemic and have employees. The wealth, the net worth of the average white family $171,000, and it is 10 times the average of a black family, which is $17,500. And in fact, by 2050, the median wealth of black and Latino families is expected to fall to $0. So these gaps in wealth are reflected of the effects of accumulated inequality and discrimination, and they reflect a society that does not provide equal opportunities to each member. So I would say that to say that not having access to wealth also leads to the barriers to entrance to college, which can limit job options and block access to higher paying job options and lead to lower paying and less stable jobs. And these people with limited job options are more likely to have less flexibility to leave jobs that put them at higher risk of exposure to COVID-19. And furthermore, people in these situations cannot afford to miss work due to not having the finances saved up to cover any essential items. So medical racism is the prejudice and discrimination in medicine in the medical/healthcare system based upon perceived race. And it can occur in four ways. Conceptually, where healthcare providers are products of their upbringing and can bring biases of their upbringings into the workplace. Collective racial discrimination, which is based on the shared cultural beliefs and can result in differential medical treatment or care. Experiences with racism in society in the medical setting, which can result in stress that negatively impacts health. Institutional racism in the medical/healthcare system can affect the quality and quantity of healthcare for minorities. So, due to medical racism, Black Americans, for example, are more likely to die from cancer, suffer from chronic pain, diabetes, and depression. Black mothers are more likely to die in childbirth, and typically the amount of wealth a mother has would have an effect on how they sustain, or how likely they are to die during childbirth. But in Black Americans, the amount of wealth that they have does not make a difference in that. And Black children also report having higher levels of stress. So with COVID-19, due to the existing supremacy and racial hierarchy, minorities are less likely to have their systems taken seriously by caregivers and are more likely to not have access to proper health care. Furthermore, doctors have also said that in medical schools, they were taught that certain minorities are predisposed to certain diseases to the point where minorities are measured on different metrics than white Americans based on racist rationale, which has also ultimately led to deaths in minorities. So, one of the things that stuck out to me, which I had read up on in the past, was that Black Americans are less likely to get lung transplants because they look at, well, using the metrics, they look at creatine levels, and the creatine levels in Black Americans tend to be higher in comparison to white Americans. But because of those levels, it puts them, I guess, out of reach or not in the right mark to receive these lung transplants. So furthermore, disparities in healthcare access, minorities are more likely to be uninsured, and healthcare access can also be limited due to a lack of transportation, childcare, or ability to take off from work, communication barriers, or cultural differences, which all have left people unable to receive proper care in the instance that they do become sick with COVID-19. And some minority groups are even hesitant to seek care because they distrust the government and medical professionals following inequities in treatment and historical events such as the Tuskegee study of untreated syphilis in African American males and the sterilization of Puerto Rican women. So, some solutions. According to the CDC, the only real solution to address these disparities is to address the racism that's embedded in our society. So, in conclusion, as long as we continue to have racism in our society, we're going to continue to see disproportionate effects in the instance that we do have pandemics affecting minority communities. Thank you.